Historically, placing implants under the muscle was very common, especially when implants were less cohesive. Surgeons used muscle coverage to help soften the upper breast, reduce visible edges, and lower the risk of rippling in thinner patients. At the time, this made sense based on the implant technology available. But implant technology has changed dramatically. Because of this cohesiveness, we no longer need to rely on the muscle to disguise the implant in most patients. This has allowed us to move towards more anatomically appropriate placement. In our practice, we now rarely place implants under the muscle. Instead, we most often use a subfascial placement, which means the implant sits over the muscle, but underneath the muscle's natural fascial layer. This provides coverage and support while allowing the implant to sit in a more natural position on the chest. There's less pain and faster recovery. One of the biggest advantages patients notice is recovery. When implants are placed under the muscle must be stretched and manipulated, which can significantly increase postoperative pain. With subfascial placement, we avoid disturbing the muscle, so patients typically experience less discomfort, recover more quickly, and return to normal activity sooner. It also results in more natural movement and appearance. Placing implants under the muscle can sometimes create an unnatural movement of the breast when the chest muscle contracts, a phenomenon called implant animation. Because subfascial implants sit over the muscle, this animation doesn't occur. The breast moves naturally both at rest and during activity, which is especially important for athletic or active patients. You get a softer, more natural looking result. With cohesive breast implants and subfascial placement, the breast often looks and feels more natural, especially in the lower pole and central breast. The implant isn't being pushed or distorted by muscle movement, allowing the breast to settle into a more natural shape over time. So placement is still individualized. That said, there is no single placement that's right for everyone. Factors like anatomy, tissue thickness, goals, and prior surgery all matter. The key is choosing a technology that matches today's implant technology and your individual body, not just doing what was standard years ago. So over versus under the muscle isn't about trends, it's about evolution. With modern cohesive implants, subfascial placement often provides a more natural look, less pain, faster recovery, and eliminates animation issues. If you're considering a breast augmentation and want a thoughtful, up-to-date approach, schedule a consultation with us at Saratoga Springs Plastic Surgery. I'm Dr. Dimitri Koumanis. We'll help you choose the placement that's right for you. Call us at 518-583-4019 or go to saratogaspringsplasticsurgery.com.